Good evening. Is India becoming increasingly unhealthy? Are Indians becoming increasingly prone to killer diseases that affect the heart and lungs? A recent report published in the University of Washington titled "The Global Burden of Disease Generating Evidence" puts India at the bottom of the table compared to its neighboring countries when it comes to death rate and life expectancy. The report pegs an unhealthy diet and indoor air pollution, mostly from cooking with wood fire and charcoal in poorly ventilated homes, as the two biggest disease and death risks. And if pollution, heart disease and killer roads were not enough, there is the macabre spectre of gender violence that has battered women's health in India. Suicides among young Indian women have doubled in the last 20 years, with deaths attributed to self-harm among 15 to 50-year-olds rising from under 5% in 1990 to 10% in 2010. Life expectancy in India, even though higher than previous percentages, is still lower than our immediate neighbours. Compared to India's 65.2 years, life expectancy in 2010 was 65.7 for Pakistan, 69 for Bangladesh, 69.2 for Nepal, 69.4 for Bhutan, 75 for Sri Lanka and 75.7 for China. Ladies and gentlemen, tonight on The Big Picture, we take a look at what is ailing India, quite literally, and why. We will explore the healthcare scenario in the country and try and get a sense of ground realities as far as lifestyle diseases affecting the population are concerned. And to help us understand the scenario better, we have a distinguished panel to help us tonight. We have in the studio Shailaja Chandra, former secretary in the Ministry of Health, Dasgupta, associate professor from JNU, and Dr. Rachna Singh, lifestyle management expert as well. We'll have another guest joining us in just a bit. I'll introduce him as and when he comes along. Many thanks for joining us on The Big Picture. I'd like to start with you, Doctor. How sick is India getting, really? Are we getting sicker? Yeah, I'm starting with you. Are we getting sicker by day owing to our lifestyle, this dog-eat sort of dog world with its pressures and pushes and pulls? Are we as a nation getting sicker?
Yeah, so I'm actually Dr. Manvir Bhatia.
My apologies, my apologies.
And yes, as a nation, I think what's happening is the lifestyle that one is leading now in 24/7, as it's called. It's having a little impact on our health, mental health, and I would say physical health. And that's the reason why this whole impact is coming.
But how far does it really go? Is it really affecting our psyche as individuals as well?
Yeah, it's affecting, see, because the cases of depression are going up, the cases of anxiety are going up, the higher ability to or trying to achieve or this performance, which has become like a big stress factor. So as a neurologist and as a sleep expert, I'm seeing a lot of patients with all these problems.
Right.
In addition to that, the lifestyle being poor, the working hours have extended to much longer part of the day. So there's no time for physical activity. It's mostly all indoors. So all the younger population is getting a higher chances of getting higher lipidemias, raised blood pressure, diabetes, and the physical health is going to go down as well.
Right. I want to come to you, ma'am. Same question, of course. Your first reactions on the report as well. I'm sure you've read about the report. Yes. Then I have another question for you, but first thoughts.
No, the report is correct, and I'm glad that the newspaper Hindustan Times has really blown this up, because it is really something the population must know about. My own reaction is that if we spend more time on prevention and probably less time on thinking of tertiary high-tech equipment, which might save a few hundred lives, a few thousand lives, they're precious lives, but it is nothing compared to lakhs of people who are going to succumb to early deaths because of the fact that they have got into this syndrome. One is the poor people and the firewood, which you very correctly said that we have not overcome that, and women particularly are susceptible.
Especially in rural areas.
Certainly. And then, of course, the bidi smoking and all is also a problem. But let us talk about the issues of stroke and terrific salt intake that Indians have, terrific mithai intake. Two things that I want to mention, which will tell you exactly why public policy is not going the right way.
I want to mention that a little later in the program, but yes, carry on, please.
What I wanted to say was, take a country like Hungary, small country. They have taxed heavily salted foods, the chips and all the things that go into it.
So-called junk food.
In less than a year, 15% has been the reduction in the rate of this kind of manifestation. Of course, I mean, New York, I think the mayor is trying to bring these 1 liter, 2 liter bottles of Coke and things like that, just banning it. That's not so easy, because it's like plastic bags. You ban it in Delhi, but it will come from somewhere else. Right. But governments are thinking of policy measures which are health oriented. I think our government has taken a lot of measures for tobacco, but I think the measures needed, the preventive measures, if you give me a chance, I'll talk about
Absolutely.
them. But basically,
in a later segment, I'd like to talk about healthcare policy.
I just wanted to say that public policy has to very heavily concentrate on preventive health. It's not glamorous, it is not high tech, it is not going to get you a lot of pats on the back from the medical community, but that is what we need.
Right. Coming to you, Rajiv, what I want to ask you is the diseases mentioned, so-called lifestyle diseases, heart, lungs. You think really that the affluent, like ma'am mentioned right now, the mithai intake and the salt intake, but it's affecting really, really poor people as well. There's no distinction there of a social status anyway. Everyone is falling sick.
When the term lifestyle was coined, which is about 50 plus years now, the whole epidemiological paradigm was that these are choices, you make, that you choose to smoke, you choose to drink, and so on. But as subsequent epidemiology has shown, that in most cases, and certainly so in our cases, particularly in the context of the poor that you mentioned, these are really compromises and not choices. So we are actually making a whole lot of health compromises or lifestyle compromises rather than lifestyle choices.
Right.
So the whole word lifestyle is actually rather skewed and a bit ironic.
Diseases of choice would be better then?
No, these are lifestyle compromises. And today, what we conventionally understand as double burden is a burden from communicable diseases, the so-called unfinished agenda, the unfinished agenda of something as basic as water and sanitation, and the other, this whole gamut of non-communicable diseases. That's one kind of double burden. The other kind of double burden that we are facing, and that's what you were initially referring to, is the burden both among the well-off sections as well as among the poorer sections, which requires some elaboration, but perhaps a little later.
Right. It's interesting you mentioned communicable disease. I have some figures and I want to share them with my viewers. The amount of deaths and people living with communicable disease hadn't really increased from, say, from 1990 to 2010, those 20 years. But there has been a drastic increase in the number of people who are suffering and dying from non-communicable disease, like Rajiv just mentioned now, or lifestyle disease or compromises like Rajiv mentioned as well. So is it then, and I want to put this question to both Dr. Manvir as well as Shailaja ji, that have we been able to conquer communicable diseases but somehow been left out when we talk about non-communicable disease, when it comes to diseases of the heart and lungs and other such like? First you and then you, ma'am.
I think what happened is over the years, there was a lot of focus on the communicable disease. So there was a lot of thrust and creating awareness about the communicable diseases, whether they came from whatever the source. And I think the public health policies, and which was a big effort. So those, the public, whether it is urban or rural, compromised or not compromised, or the affluent, have got a hang of it and have understood that this is how it is caused, this is the impact, and this is what happens. But as a result, I feel the non-communicable diseases have not had so much of an impact, and maybe we've not been able to create an awareness, number one. Number two, I think the lifestyle diseases or the compromised, the scenarios differ in different areas of the country.
So we can't generalize.
We can't, and I think the lifestyle terminology is okay for some people who are living in the affluent or the other upper class. They are the ones who are going to suffer primarily a lot from these non-communicable diseases.
Right.
Heavy lifestyle issues.
Absolutely. Have we sort of been left behind when it comes to non-communicable disease? Do you agree with what Doctor had to say?
Yes, I agree, and I think that we have been left behind because quite apart from our neighbours, if you look at the BRIC countries, we are the rock bottom there also.
There as well, yeah.
So it's a phenomena where we call ourselves low, middle, the lower in the middle in the lower income bracket, but we are very, very low when we look at the health indices. And certainly this non-communicable diseases is something that's going to hit us, and that's going to take away a lot of money when we've not crossed the hump, the double burden of the what Rajiv just talked about. And there I would say a lot of attention was paid to tuberculosis control, to malaria control. HIV we've been able to control, considering what India was supposed to be facing. We have not really had to face that. That is because not only money was spent, but a lot was done for awareness building. It became a kind of a passion and a mission with not only the Ministry of Health, but the state governments. I think here the NCD problem is definitely one of awareness building. State governments are not paying the kind of attention that they need to pay.
Also, another topic I want to touch upon, perhaps after the break, but coming to you, Rajiv, some more figures that I have here, and obviously from the report as well. I'm going to quote them to our viewers as well. The report also noted, ladies and gentlemen, the number of cases of heart disease. Now, there's a 66% increase. That's a drastic increase by any yardstick. Diabetes, another killer disease, 93% increase has seen, of course, again, a drastic rise. Again, very worryingly, the report also noted the reporting of ailments such as migraine, for that matter, depression, low back pain, neck pain, these sort of lifestyle choice diseases, like Rajiv mentioned, have increased dramatically over the period of the last 20 years, maybe. Now, is that indicative of severe changes in the way we live our best years of our lives, say our 20s, 30s, and 40s?
It's certainly indicative of these diseases going down both the social ladder as well as the age ladder. Again, perhaps half a century back, these diseases were understood to be affecting the top management, the so-called managers. But now research is quite clear that it's not the manager, but the second and third rung employees who are really the worst hit.
Right.
And it affects not only life expectancy, but any of the biochemical parameters that one may test or diseases that may get manifested.
Hold that thought. I want to come back to you right after the break. We'll take a small break right now. We'll come back and discuss what Rajiv and I were discussing just before. I'll come back straight to him as well. Take a break. Stay tuned. Don't go anywhere. Welcome back to The Big Picture. We're discussing lifestyle diseases and, of course, how Indians are getting sicker and sicker. Before the break, Rajiv, you had a point. Continue, please.
What I was saying is that it's now quite evident that the higher employee in the work ladder, the more insulated he or she is. And this is very, very clear from a very large-scale study in England among the British bureaucracy, which is called the Whitehall study.
Right.
And to extend the core of that, which the WHO brings out in an earlier report of 2008, called the Report of the Commission of Social Determinants of Health. At the very core, which incidentally has 2 Indians on the committee, including Professor Amartya Sen, which very pointedly calls or the lack of social justice at the cause of all ills. So while on one hand you have certainly very, very immediate factors such as those being mentioned, such as really the lifestyle issues of maybe lack of sleep, high salt intake, high lipid intake, and unhealthy diets, and lack of exercise, so on and so forth. But if you step out of that ring, it's really largely the way society is organized and the way things work or don't work that actually work through what is very mystically called stress.
Rajiv, I want to come to your fellow panelists here before we take another break, of course. I want to come to you first. Shailaja talked about the healthcare policy, and she did mention that the government has taken some steps. Perhaps the state governments need to take more steps. I want to ask you this, first you, and then I want a reaction from you as well. The health policy, the national health policy right now, some people would say lies in deep doldrums right now, needs far more investment in public infrastructure as well, public healthcare system as well, instead of the current system right now, which sort of leads people towards private healthcare. Do you think we need a revamp of our healthcare system?
So I think I would agree with her that, we need to focus a lot on prevention because the cost of healthcare is tremendous in all these disorders that we are just listing. So if we can put a lot of effort onto prevention, it will save the country, billions of dollars or billions of rupees.
Right.
So
and it will be far more effective.
Far more effective.
Yeah.
But to work towards prevention, I think the policies, now we do have a lot of insurances coming into the country, but there are a lot of lacunae still. So like when we deal as a medical professions with these insurance companies, they are not, let's say, funding or giving source for lots of diseases which could be prevention.
Right.
So which we are trying to talk, and I think we should talk to the health, the ministries, etc., for helping these insurance.
So more dialogue is needed. Before I come to Shailaja, Chandra, I will take another small break. We'll come back. Stay tuned. Don't go anywhere. The better part of the big picture is just coming up. Welcome back to The Big Picture. We're discussing whether lifestyle diseases are a ticking time bomb that is going to affect Indians in the future as well. Shailaja, Chandra, before the break, we were talking about the public healthcare policy. Your thoughts on that? You seem to think that the government has done enough.
No, I haven't said it's done enough. It can never do enough in a country like India because you really are short of resources. The investment in public health, both government of India and the state governments, is very low. But having said that, I mean, having worked at all these programs and seen how they have developed, certainly every effort has been made to see that we contain these communicable diseases. But I would say that now the time has come to give a signal. And I would say something like mithai, it is taxed at 4%. Everything else is taxed at 12%.
Maybe triple that as well.
No, you bring it down by a third. 4% is nothing. When mithai is treated as, "Arey, hamara to culture hai," and you know you have so many festivals, you know you have so much of lena dena going on, and people eat not one laddu but maybe 4.
Right.
Now, that kind of a culture, if you're going to pamper it, knowing full well that this is going to be an absolute ticket for getting into problems, I think that there's no need for government to what shall I say, frighten people. But I think the doctors certainly have to be less soft when they deal with a diabetic patient or a person who is on the borderline, not be soft and say, no, but drugs can take care of it, you know, we will be able to, you'll have a long life.
So
no, it is something.
Clamp down on that.
Clamp down on them. And I would say that something as serious as taxing things is something that gives the signal.
Perhaps the right step in the right direction.
And that can be done, prevention can be done. And lastly, I do feel, because I've worked for long years also in the Indian systems of medicine, I think Ayurveda, Unani, Siddha, Yoga have a lot to offer, but the scoffing and the kind of, oh, this is a peripheral activity, these are the things which can be the Indian answer.
Fair point, fair point. We also have another guest with us who's just joined us right now. Before I come to the part where we discuss the states and how they take their healthcare policies, I want to introduce my new guest. Dr. Rachna Singh is a lifestyle management expert as well. Many thanks, ma'am, for joining us today. I want to ask you about self-harm cases that have increased as well, because I'm sure in your job you come across a certain amount of cases which deal with that. Indians are also indulging, according to the report that just came out, in self-harm, also dying in road accidents, but we'll talk about the self-harm first. The rise in the number of people indulging in self-harm apparently has spiked by 136%. Now, that's a huge increase. An increasing number of youths are depressed. Suicides are really common now. What are the causes that you think have led to a dramatic increase in depression cases?
Over the last 10 years, actually over the last decade, the number of cases we're seeing with the rise, huge number of rise in anxiety, depression, specifically over with the youth and spilling over to early adulthood also is absolutely enormous. One reason is that there is more of an awareness today where people are able to recognize what depression is all about. And secondly, certainly because of the lifestyle which is altered so dramatically. Today, you know, as a society, we're dealing with a big dichotomy where we have a particular system, an Indian system, which we are kind of juggling to deal with, the value culture system which we are dealing with. And on the other hand, we have this new idea, the new Western setup which we are running behind. So where the youth is stuck is in between both.
And they can't seem to decide which boat to put their foot on.
Absolutely, because the value system still remains stuck, you know, and then we are exposing them to, let's say, disposable income, we are exposing them to the pub culture, we are exposing them to alcohol, so many other things, you know, the Western culture per se. And nobody's saying that anything's wrong, but somewhere there is a mismatch and the balance is missing.
I have a couple of questions for you. One, do you think that the number of suicide cases among the youth has increased? Depression and suicide used to be something that you associated with maybe old people or maybe middle-aged people, but now the youth has fallen prey to it. Do you think there is a pattern there?
There is a pattern because I'm seeing a lot of adolescents actually going towards, you know, pseudo-suicides or passive suicides or attempts because somewhere the pressure, like I said, the societal pressure is so huge and high, you know.
Stemming from performance pressure?
Performance pressure, peer pressure, stemming from a huge amount of loneliness, you know, coming in homes now because, you know, as such the family system, the joint family system breaking down into a nuclear family system. There's not very much support around available, people being so busy with their lifestyles and time schedules are so erratic. So that is also posing a big problem. So like I said, the adolescents I see the kids from, trying to appear at this crucial time for their board exams, that itself creating a pressure going up to early adulthood, where early adulthood people are juggling with issues of relationship issues, marital issues, discomfort of adjusting to society.
Rajiv, I just want to ask you one thing. You mentioned the exposure to alcohol and the so-called pub culture. Do you think that's
right.
also largely responsible? Do you not think that perhaps the cross cultures, do you think we put too much emphasis on that? Or do you think that really affects the psyche of the youth?
What really affects is the imbalance. So there's really nothing wrong in the pub culture. It's just that the youth doesn't know where to draw a line today.
Right,
yeah, so that's really what is causing the problem.
Absolutely. I want to come to Rajiv now. We talked about the public healthcare system in the country as well. And she said, of course, no government can really do enough ever, but there have been some steps taken in the right direction. This year's budget, saw an increase in spending in the healthcare sector by the central government, but analysts say, and people I talked to even today, some really senior doctors, and they said that unless the state governments act on improving healthcare facilities in their own states, it's not going to matter how much money the central government pumps into it. Do you think our state health services are also to blame to a large extent?
Health is a state subject, and therefore largely what rolls out on the ground is in the hands of the state governments and the state health departments. Now, on one hand, there are states which have very successfully brought about certain reforms, which has improved, for example, medicine supply. Yet there are state institutions which are completely dismal, to say the least. So even the Indian states present a very heterogeneous picture. But yes, ultimately, as far as the delivery of health services go, the states and the institutions, including the frontline workers, where actually that's another whole dimension where a whole lot of de-skilling has taken place, and coping with non-communicable diseases actually mean imparting them with new skills and some of the reskilling to happen. So across this wide range of issues, there are certainly very deep lacunae in the state health services.
Your thoughts on the state services, Shailaja? You heard what Rajiv had to say, of course.
Well, I think that the state services, I mean, they don't, in the pecking order, somehow health does not, howsoever much money you may give, it doesn't, it's just in the lower quintile.
Do you think it's always been ignored subconsciously by
people? It was completely ignored. Now it is not being ignored. Certainly, the money that has been given under NRHM has made the facilities at least come up. They're reviewing other doctors, there are the specialists, there's the equipment, there are the drugs there. That is being monitored. That was not being done to that extent. And I think that is something, and putting pressure on the state governments is something that is going on. But I do feel that there are many things the states can do by way of policy. For instance, if Japan has a system whereby the executives and the officials, regardless of elitism of who you are, you're a board member or anything, you stand up every 1 hour and you jolly well do some exercises where you are, or you meet at a place. I have seen people in South Korea and Japan early in the morning before office starts, standing in the yard and all together doing those exercises. So you get it in your mind that you have to attend to these kinds of things. Secondly, I would say that the state governments, to spend on prevention, I mean, you can certainly tell the entertainment industry to somehow the other build this into the culture instead of building up the alcohol and the kind of, smoking kind of a culture which is there. We have succeeded to a large extent. I think 10 years ago when I was in the ministry, if somebody had said such measures would be taken for tobacco, I would have said out of question. The lobbies for tobacco were so strong, and the Labour Ministry also was not very keen on it, and it just seemed impossible, but we did manage. It can be managed, and it can only be managed if you make it into some sort of an awareness program of the standard of HIV/AIDS.
Point taken, point taken. Dr. Manvir, you're a neurologist now. Do you think, like ma'am just said, smoking and depicted in films or television serials or other forms of entertainment, do you think we need to clamp down far more strictly, and would that have any effect?
I think what I was just going to say with the state thing also is that literacy plays a very big role. So in my view, that if we can educate and the public, and in the states where the literacy is high, you will see the health is much better.
Right.
So that should also go hand in hand when somebody is laying down state policies. Second question, yes, I think if we clamp down and again show a lot more about the impact of this, rather than just saying it's injurious to health. You know, I just saw a movie the other day, and in that they showed about tobacco chewing, and they had a cancer hospital in Bombay, and there was a person saying that I can't swallow, I can't eat, and he was 21 years and he died. And I think that kind of a thing frightens people.
It does.
It's maybe sounding horrible or scary, but that's
no,
what
it certainly frightens people. It certainly
rather than just
me.
putting one line and saying that, you know, it's injurious to health. That they don't understand.
We have very little time on the show, but I want to give the last word to the guest who joined us last. Dr. Singh, how can we as Indians, and this is perhaps the advice you can give us right now and the viewers who are watching right now, how can we as Indians try and defeat or diffuse this ticking time bomb? What are the steps that an individual can take at his or her own level to reduce the risk of falling prey to these ticking time bombs, as we call them?
Okay, I'd say for everybody, we should follow a very simple strategy, which is an ABC strategy, where A, I would say, is awareness. First, be aware of what is it that I am doing wrong. Rather than really looking into our neighbor's lifestyle, let's look into our own lifestyle and see what is it that I am doing wrong? Where can I make steps to change things?
Right.
So once we have that, and B would be a balance, to create a balance, like I said, between both the culture systems, what the youth is juggling between, and C would be to take control measures.
Absolutely.
So, you know, taking some steps towards controlling our lifestyle. So, for instance, eating a healthier diet, making sure we have an exercise regime, making sure we have some amount of discipline around us, some time for leisure, for sure, recreation, getting sure that you have a good enough night's rest. All that would sum it up and make sure that we all lead a healthier lifestyle.
On that note, I have to wrap the show. I must thank all my guests, of course, Dr. Manvir, Bhatia, many thanks. I got your name wrong the first time, but this time I'm getting it straight. Also, Shailaja, Chandra, Rajbir, Dasgupta, as well as Dr. Rachna, Khanna, Singh. Many thanks for joining us on The Big Picture. Like the good doctor said, A, B, C, Indians, take control of your lives. Be aware. Achieve a balance if you can. And like Shailaja Chandra said, I think that's the key takeaway from tonight. Prevention is always better than any cure that we can come up with. That's all the time we have on The Big Picture tonight. Athar Khan saying goodbye, good night, and thank you for watching.